Good morning, everybody. Dr. Brace here. It's Facial Plastics Friday, January 15th, 2021. Well, we find ourselves amidst the second emergency lockdown here in Ontario. And for us, that means that we've stopped doing in-office injectables and cosmetic laser therapies for the time being. The college that regulates us has not told us to stop doing surgery. And so I am here today at Guelph General Hospital operating. We are doing a couple septoplasties, another forehead flap for a cancer reconstruction, and then a septorhinoplasty for breathing issues. And so it's a busy day. Spent the day yesterday at 360 doing face and neck lift and 2 rhinoplasties, and we continue on with cancer surgery next week and more facelifts and rhinoplasties. So surgical side of things stays busy for the time being, but in the office, we are trying to help people abide by the stay-at-home order and are not going to be doing injectables for the time being. So that being said, today I want to talk about what you can do in this time when we're shut down, and that brings us to skincare. There are 4 basics for facial skincare that everyone should be doing. And I often will tell this to people in consults. There are a lot of products on the market, things that you can do for your skin, but what are the 4 things that you should be doing? Number 1 would be an exfoliator. And I am biased towards the weak acid exfoliators. I don't like the gritty mechanical exfoliators because they're traumatic to your skin. And so something like a Skin Medica alpha hydroxy, beta hydroxy acid, that's my favorite one. I use that every day. 10% glycolic acid wash or similar things like that. Weak acids will help to take the dead layer of skin off so that your skin looks more fresh and so that the other products you use can penetrate better through that waterproof layer and get to your skin to do what they need to do. So start with an exfoliator in the shower or when you wash your face every day. Number 2 would be retinol. A lot of people say, I've tried retinol, I'm allergic to it, or I can't tolerate it because it made my skin red and dry and itchy. This is normal. This is what retinol does. And there are different concentrations of retinol and different formulations. And some people do better with other formulations than others. So if you want to get your skin looking as good as possible, especially in these winter months, because retinol will make your skin more photosensitive, so it's a good time to do it so you don't have the risk of a sunburn. You can start with a low dose retinol. We carry both Skin Medica and Vivier. I have people that love the Skin Medica and others that hate it and others that love the Vivier and others I think it doesn't do enough. So finding the right product for your skin is a bit of a trial and error. But once you find it, putting retinol on your skin will help your skin turn over quicker so that you have fresher, newer skin on the surface all the time. It will help with your tone, evening out your tone, and it can even help with fine lines. The thing about retinol is you have to push through the hard part, the red, dry, itchy phases, and that can be a couple weeks to a couple months before you get to the part where you get the clinical result. And all the studies on skincare, no matter what product you're using, if you look at before and after results in somebody's website or advertisements of a product, it usually takes 3 skin cycles to get that result. And that means about 4 months of daily use. So keep in mind, skincare is a marathon, it's not a sprint. And so if you want to try to do something for your skin in these winter lockdown months, retinol is a great place to start. Because retinol makes your skin so dry, you need a good moisturizer. I am personally a big fan of the Skin Medica Ultra Sheer and Rejuvenative moisturizers. Those are my favorites. So I use the exfoliator every day and the moisturizer every day, and I'm on and off with the retinol. And then the last piece for the 4 basics of skincare would be a good SPF. Even in the winter months, you want to protect your skin from the sun. And so using an SPF that's 30 or above is what is recommended. And the ones that I prefer are the ones that are the physical blockers of UV rays and not the chemical blockers. And this would be zinc oxide and titanium dioxide based sunscreens. And so if you want to know more about skincare, are interested in kind of starting a regimen, Brittany at the office is very, very well trained and very knowledgeable in all of this, and she can chat with you on the phone or through email. And we still have curbside pickup during this lockdown. We carry other products from Vivier, like the Grenzine and the vitamin C serum, which are fantastic for hydrating the skin, for firming the skin, for increasing the health of your skin by reducing oxygen-free radicals in the skin that cause damage and cause wrinkles. And so there are lots of additives you can put onto a regimen beyond the 4 basics. But if you're looking for the basics, start with an exfoliator, a retinol, a moisturizer, and an SPF, and your skin will thank you for it. Stay safe, everybody. Hopefully we'll get through this soon and be out of the lockdown in a month or so. Have a great day. Bye-bye.